Hello everyone, I am Dr. M. 𝙤𝙤𝙝𝙬𝙚𝙬𝙬, Associate Professor, Department of Microbiology, Karpagam Academy of Higher Education, Coimbatore. In the previous lecture series, we have seen about safety precautions to be followed in a microbiology laboratory. In today's lecture series, we are going to see about clinical diagnosis. Yes, the term clinical diagnosis. Clinical diagnosis is a very important process in interpreting a disease or making a diagnosis of a disease. So, this is a combined process where various stages of collection of specimens, processing, transportation, then diagnosis all integrated together. The clinical diagnosis. The word clinical stands for the clinical specimen, which is nothing but the medical specimens which we collect from the patient. Diagnosis is the methodology where it is employed for diagnosing or identifying the pathogen which is responsible for causing the disease. So, here first is clinical specimen. This clinical specimen, which is called as biospecimens, that is collected for diagnosis. The types of clinical specimen which we are going to look in today's lecture series are: first one, pus, blood, urine, sputum, stool, skin scrapings. These are the basic clinical specimen that has been collected from a patient for diagnosis. So, it is also important that these specimens should be collected appropriately, exactly at the time of infection, and it has to be processed and tested immediately with utmost care. So, here we are going with the first thing, it is called collection of pus. Yes, pus specimen can be collected from wound, ulcers and abscesses. What is this pus? Pus is nothing but the cellular or a fluid or a lesion like exudate which comes from the wound, ulcers and abscesses. As you know, the term wound is nothing but a cut, abrasion or a break or injury, you can call it as a wound, where the lodgement of the organism is high. Ulceration is nothing but the topmost layer or the superficial epidermis has been damaged. You call it as an ulcerated area. Abscesses is nothing but a pus-filled cavity or a deep-seated cavity which contains the pus specimen. So, this pus is collected from wound, ulcers and abscesses in two methodology. The first methodology, it is called as spontaneous rupture. The spontaneous rupture is nothing but when the wound dehisces, the wound has got a cap at the top. When the cap breaks and when the pus comes out of it, it can be collected, that is called as spontaneous rupture. In this case, you can use a sterile swab to collect the pus specimen which is flowing out. The second methodology, it is called incision, where the wound surrounding is completely cleaned using a spirit cotton. Then the pressure is being applied around the wound so that this pressure will make the wound cap to open or dehisce. From there, the pus is being taken out. So, this methodology, it is called as incision, or you can call it as an induced methodology. There is a third method which is called aspiration. In the case of deep-seated infections, using a sterile needle and a syringe, the deep-seated pus can be aspirated. This is called the collection of pus specimen. Second one, collection of blood. The blood can be collected for various purposes, for blood grouping and for diagnosis. So, in this case, the blood can be collected in two main methodology. The first one, it is called as lancet prick method. In lancet prick method, the patient's fingers, it has been cleaned using a spirit cotton, and the finger has given a gentle pressure so that you will see the blood spot. In the blood spot, using a sterile lancet, make a gentle prick and allow the blood to come out through the prick hole. So, this method, where you will collect the whole blood. The blood has been directly placed on the glass slide for diagnosis. What are the tests which can be done through this? First one, for blood grouping, you can adopt this methodology. Second one, in the case of a malarial parasite detection, When a surveying person from the corporation or the government sector or from the hospital, when they visit home to home visit for the malaria, they make this sort of a methodology. They make a lancet prick using the blood which comes out, the whole blood, they smear it on the glass slide that labeled, and that is gone for the microscopic examination. This collection of whole blood can be done using this lancet prick. Even the peripheral bloods also collected. But in the case when a newborn babies are there, you can adopt the same methodology. Instead of finger, you can go for the heel. You can take the baby toe, the heel part, and gently make a prick, and you can collect the blood. So this methodology, it is called as lancet prick method of collecting the blood. The second one, it is called the vein puncture. Vein puncturing is nothing but you make the patient to sit calm, rest the arm, and then first we have to apply the tourniquet. Tourniquet tights and helps the vein to plunges out. When the vein comes out, make a gentle tap at the elbow area, and using a spirit cotton, you wipe and fix the vein. Once if the vein is fixed, make the patient give an instruction that he should not move. Using a sterile needle and a syringe, you have to draw the blood. This blood should not be aspirated rapidly or fast. So before, when you inject a needle, you should have a little bit of the air space. When the blood, it has to flow along the roll of the gravity and it fills, then gently you push the syringe, recede the syringe back so that the required volume of blood is collected. So this methodology of collecting, it is called as vein puncture. This vein punctured blood further goes for separation of serum, plasma, platelets, and even the fractions of the blood can be separated. So this is called the collection of the blood. In the collection of the blood, you will have plenty of blood tubes, blood collection tubes. Some are filled with EDTA, some are not filled with EDTA, and there are various color codes for this. What is the role of this EDTA and other stuff? This is called as anticoagulant. So which you adopt for further processing like separation of plasma, separation of serum can be done. So this methodology, it is called collection of blood. The third methodology, that is collection of urine. Okay, collection of urine. Why do we want to collect urine specimen? The urine specimen is collected when there is a urinary tract infection. Second thing, when there is any blood stained urine you found in the patient's urine, you want to have a diagnosis, or you want to check the urea sugar level or the uric acid content, all these things. Apart from that, to detect pregnancy, also we collect urine as a specimen. So in this case, the first and foremost thing as a microbiology laboratory personnel is to instruct the patient about the importance of specimen, especially while collecting the urine, because the patient has to clean the genital area using a soap and a water, and has to gently dry the area using a tissue paper. Then they have to go for processing. So this process has been done first. Then you instruct the patient to give midstream urine. Okay, this is not an easy task because the laboratory personnel can't go and collect for everyone, but it is advisable that the laboratory person has to instruct the patient what is meant by midstream urine. In the urine, the patient, when he or she is going to void the urine normally, in that case, you instruct them, they have to pass few ml of the urine first and make a stop or a constriction. Then they have to open the sample container. Then few ml or the required volume of urine is voided into the sample container, and again he or she has to construct the urine. Then the sample container is closed completely and the residue or the remaining part of the urine is flown out or voided out. Such a methodology is called as midstream urine. Why we collect this? Because in the initial few ml which is allowed out may contain the residual microbial flora which may be present in the urinary tract. Second thing, in the middle portion, the causative agent that is responsible for a particular infection can be diagnosed. So that is a reason we go for a collection called as midstream urine. This can be done by using voiding. Voiding is nothing but the normal passing of the urine. So in this case, this is possible for a patient, you can give instruction. But in the case of a bedridden patient, you have to go for a process called as catheterization. So catheterization is nothing but inserting a tube through the genital opening, and gently it is being pushed inside so that it reaches the bladder to collect the urine. So here the care should be taken by the laboratory personnel or the hospital personnel, because when you are trying to insert a foreign particle or a foreign substance like the catheter through the urinary open, sometimes if you have a contaminated hand or if you contaminate the catheter, that will lead to urinary tract infection. There are different types of catheters like glass catheter, French catheter, rubberized catheters are available, indwelling catheters are all there. So these catheters helps in collection of the urine specimen from the patient who are bedridden. In the case of kids, young ones, this is a practice that is practiced in very ancient time. The methodology, it is known as dip slide method. In this case, when the kid is passing the urine, the slide which is coated with the agar is gently passed in between the urine specimen so that the urine specimen is directly coated on the media. From there, it has been the organisms are isolated for further diagnosis. This is about collection of urine. The next collection is nothing but collection of sputum. This is also a very critical condition, because the first thing, the laboratory personnel has to give an instruction to the patient that they have to give the sputum specimen with less salivary contamination. Generally, you cannot collect sputum without the presence of the saliva. So in this case, you instruct the patient to gently gargle the mouth completely, spit it out, then ask them to take a deep breath and make a deep cough, and that has to bring the sputum out of the lung so that that is to be spitted into the sample container. So this sort of a precaution to be instructed to them so that you will get sputum with less salivary contamination. In this aspect, the sputum is collected in the early morning. Why early morning? All through the day, the person is at work. In the night, he is completely at rest. After a rest, the collection or the volume of sputum generated will be high. So in that case, we adopt for an early morning sputum collection. You make them give a clear-cut instruction that goggling the mouth is important, and instruct them they have to give the exact sputum with the less saliva. So this is how you collect it. And some cases when there is a scanty of the sputum, you can have 24 hours of collection. In that case also they have to goggle. Whenever the sputum comes, they have to make these precautions, and then they have to give the sample in a container. So that may be a pooled sputum collection, or you can have it as a 24 hours. So this sputum is also done. Especially, there is a technique to be followed here. In ancient times, they used, especially for many kids and people who are unable to undergo such process. So this is called a sterile gas technique, where a sterile gas is given to the patient and ask them to cough and spit. When the spitting is done on the sterile gas, the water molecule or the salivary particle will be taken up by the cotton which is present in the gas, and exactly required sputum can be picked up from the gas. And another methodology practiced during the ancient times it is also called cough plate technique. Especially for Bordetella pertussis, we go with the special type of medium called as boarded 𝙤𝙤𝙝𝙤 agar, where this plate is solidified in a Petri plate, and the Petri plate is given to the patient. When the patient coughs and spits in the Petri plate, when they cough there, what happens? The organism is loaded or it is inoculated onto the plate. So this methodology is called as cough plate method. This is how you collect the sputum specimen. The next specimen, it is called collection of stool specimen. For amoebiasis, for any sorts of like roundworm, tapeworm, hookworm infections. Many times this is done for especially kids who have got problems because they are very mischievous and the hygienic practice is very less. Next one, some people who eat raw meat, some people who eat raw vegetables, salads. So in that case, people will be a harboring host for the parasite. In such a case, we go for collection of stool. Stool is nothing but the fecal material which can be collected by tissue paper that has been pasted in the Western Seater, or the desired portion of the fecal material that is collected and it has been processed. So the normal fecation, you can collect the material. In some cases, when the patient is under constipation, unable to fecate, so in such a case, we opt a second method which is called as rectal swabs. In this case, the anal area of the patient is cleaned, gently cleaned and gently moistened. Then the cotton wool swab, which is very strong, is being inserted through the anus and it reaches the rectum, pushed to reach the rectum, and when it reaches the rectum, the swab is twisted so that it can pick up or collect the fecal material and the swab is taken out and transported to the laboratory for diagnosis. So these methods is the collection of stool. The next one, collection of skin scrapings. What is the thing that we are going to do with the skin? When there is a hypersensitivity reaction, when there is an allergic manifestation, or when the person is suffering from skin infection, psoriasis, or any sorts of skin deformities. Like this, especially we go with mainly the trichology. We all know now we have plenty of hair losses, we have plenty of hair problems, dandruff problem. In such a cases, the scalp, the dried scalp can be scratched, scraped or picked up using a sterile forceps, and such a methodology is employed for skin scraping techniques. Not only with the trichology, and dermatology also plays a vital role. This scraped skin, from that you can identify the causative agent. These are the various collection methodology. In each and every collection methodology, one sample is employed and every sample has its own specification, every sample has its own methodology, everything. Whatever the case, whether you collect the blood, sputum, pus, urine, stool, skin scrapings, whatever methodology you collect, the first thing, once if collection is done, you have to go with a media called as transport media. Because when you go for a camp or when you do a specimening, so in that cases, you are not going to process the specimen immediately. In such a case, a transport media will help to restore the organism. For example, a transport media is a media which contains the nutrients in the minimal quantity which allows the organism to survive until it is being processed. In that case, you classify the transport media into a liquid media and a solid media. These liquid medias are nothing but the broths, whereas your solid medias are the agar-based media. In this case, the transport media supports the processing and helps the clinical diagnosis a perfect one. So what all comes under your transport media? The medias like your phosphate buffered saline, normal saline, buffered glycerol water, alkaline peptone water, Kerry Blair media, Venkatraman and Ramakrishnan's media. So these are few things, Emmy's media, Stewart's media. So all these medias are the transport media. In some cases, during a cholera outbreak, people used autoclaved seawater as a transport media. So transport media is like a bridge between your collection of specimen and to the diagnosis that happens in the laboratory. This is the media which supports the organism. For example, when stool samples, the rectal swabs are collected, this Kerry Blair is a medium which helps the organism from the fecal material to survive until they reach the laboratory, because those organisms are very delicate. So here comes the diagnosis part. As all the clinical specimens reaches the lab, the first diagnosis, which is called as macroscopic observation. The macroscopic observation, it is nothing but visualizing a specimen. We come one after the another. The macroscopic observation for the pus, you check the color of the pus, consistency of the pus, whether the pus is granulated. In some cases, the pus may contain blood or a rust-like appearances. Granules are rusted in color. For blood, you can see the color of the blood, consistency of the blood, and you can go with the diagnosis, like the serum and plasma separations and other things. Urine. When you see the urine, you see the color of the urine, consistency of the urine. Color of the urine may be dull white or some pale color, yellow colored, sometimes blood stained. The urine also checked for the cloudiness. Cloudiness, the clarity of the urine. And when you allow the urine to wait or allow to settle, you will find the deposits, crystals in the urine. These are all the macroscopic observation for urine. In the case of sputum, you see whether it is a purulent or a thick sputum or a watery sputum. The color of the sputum creamy, green colored, yellowish colored. Sometimes you will get a blood stained sputum. So all these things, blood stained sputum, it is also called as rusty sputum. So all these things are the macroscopic observation for sputum. In the case of stool, you will see any sorts of a coloration. Discolorations is there, and at the same time undigested residues are there, and the worms particles will pick up, and the mucus layer might be there. All these things plays a very vital role as a macroscopic observation in the stool specimen. In the case of skin specimens, you can directly visualize the skin. There is no much, directly you observe the skin specimen and you get the scrapings or the thing that is. During that time you will see whether the scalp is oily. This contains some oily deposits or some sort of a coloration, some blood stained. All those things are the macroscopic observation for all these specimen. When you go for a microscopic observation, the second category, where it is called microscopic observation because the thing which you observe under the microscope, you call it as a microscopic observation. Like starting from your gram staining, simple staining, your hanging drop technique, your spore staining, capsular staining, lactophenol cotton blue mounting, KOH mounting, or even the immunofluorescent stain that is used for virus. All these things, whatever you subject to the microscope and you observe, this is called as microscopic observation. This gives whether the organism is a gram positive or gram negative, whether the culture is a mixed one, what sort of a property does it has. Everything comes under the microscopic observation. The third category is culturing. Culturing is nothing but the clinical specimen which you collected, you are trying to grow the organism, or you are proliferating the organism number so that which can be used for further studies and tests. So here you go with a basal media or a basic media like the nutrient agar. You go with a differential media that is like your McConkey agar, or sometimes the fastidious organism require a blood agar to find the hemolysis like alpha beta gamma hemolysis, and you have a media called as selective media. These are the selective media which is exclusively for a particular organism. For example, if you are trying to grow the organism Staphylococcus, you will have the media called as mannitol salt agar. To grow the Escherichia coli, E. coli, you have a media very specific, that is your EMP agar. For Salmonella sigilla, you have SS agar. Okay, cetrimide agar for the Pseudomonas. So all these things are very specific in the case of culturing. This culturing to select a media, all those substances can be helped with the help of the microscopic observation. The next one, the biochemical test. The cultured organism to be subjected to biochemical test based on the biochemical reaction which produces. The basic things are indole production test, methyl red test, Voges-Proskauer test, citrate utilization test, your urea hydrolysis test, then your TSI test, carbohydrate fermentation. All these tests are the list of biochemical tests which will say what is the organism is about. Next one, after that, from the culturing of the organism, you have to go with, after identification, the stage is the antibiotic sensitivity. You perform the Kirby-Boyer's technique, which is the disk diffusion method. Sometimes you will adopt a well diffusion method. So in this case, the antibiotic sensitivity testing, you give a list of antibiotics, you subject, you test, and you say that these are the antibiotic which can be used for treating the infection. That happens in the case of the antibiotic sensitivity testing. Serology comes under the samples of the blood. You go with the viral test, VDRL test, RPR, rapid plasma reagent test. So all these things is detected through the serology. Rapid diagnosis is the another methodology or the tools, because since lack of time, we want the things to be done up at the faster scale. We go with the ELISA, PCR, we have RT-PCR, all these stuffs comes under the case of rapid diagnosis. Whatever the case, this diagnosis is bridged with the transport media that goes with the collection of specimen. So all these things are collectively called as the clinical diagnosis technology. In today's lecture series, you would have learnt about what is meant by a clinical specimen, what are the types of clinical specimen, what are the instructions that you will give to the patient in the case of a clinical specimen, and how you will collect and how you will transport to a laboratory, and further how you go with the processing for diagnosis and identifying the infection and the disease. With this short note, you will have a good idea about what to be done, your role as a microbiologist in making a clinical diagnosis correct, so that the patient will not be having a wrong diagnosis. With that, thank you.